Keto diet is a very popular diet for fast and effective fat loss, meaning that your body needs to be a retroactive condition. You should eat fat in low-protein foods, carbohydrates or anything else. The ratio should be about 80% fat and 20% protein. Keto diet contains extremely low or almost zero carbohydrates over a long period of time, and a very high level of fat. The idea of this is that the body becomes the state of ketones. In this keto acid situation, it is assumed that the body uses fats as energy, and studies say it's exactly the same. Carbohydrates/glycogen liver and allow fat to break into fuel. Seafood. Fish and mollusks are foods that support sugar. Salmon and other fish are rich in vitamins B, potassium and selenium, but almost without urea. Try to consume at least 2 meals a week. Vegetables have low calories and carbohydrates but contain many nutrients, including vitamin C and many minerals. Low-calorie vegetarians are great substitutes for higher carb doses. For example, cauliflower can be used to grow rice or potatoes, zoodle can be a piston, and spaghetti is a natural substitute for spaghetti. Cheese. It is nutritious and tasty. There are hundreds of cheeses. Fortunately, they have low levels of carbohydrates and fats, making them excellent ketogenic foods as a nutrient. Cheese has saturated fatty acids but does not show an increased risk of heart disease. In fact, some studies have shown that cheese helps protect against heart disease. Cheese contains also conjugated linoleic acid, fatty fat, and improved body composition. In addition, regular consumption of cheese can help reduce muscle loss and aging. Avocado is a high level of some vitamins and minerals, including potassium, an important mineral that many people do not need to get. In addition, higher potassium intake may facilitate the transition to a ketogenic diet. Also, avocados can help improve cholesterol and triglycerides. Pros and cons. Pros. Fat burning. If you consume ketogenic foods, your body's ability to use energy stored in your energy will be improved. If your body can convert fats as fuel, it will decrease with a high carbohydrate meal. However, in your keto acid setting, your body has no choice but to use fats as fuel. It contributes to the elimination of ketones. If you have ketoacidosis, your body does not require ketones and should be excreted in the urine as waste. This means that your urine is body fat. The best thing is that your body will no longer have to use basic energy in the future. Protein saving effects. Suppose you consume the amount of protein and calories you have in your diet. If your body is keto, it moves to glucose instead of ketones. Since your body contains large amounts of fat, softening of proteins is not required to produce glucose in a process known in the art of gluconeogenesis. This means that protein is used in other body functions. It reduces insulin levels. Lowering insulin levels in your system increases lipolysis and releases free glycerol. This is different when we eat a normal diet when the insulin level reaches its peak. High levels of insulin lipolysis prevent the use of fat in energy production. In addition, low insulin levels promote the release of hormones such as growth hormone. Low blood pressure. A study in the Internal Medicine Archive has shown that ketogenic diets have exceeded the weight loss of fat by lowering blood pressure. Approximately half of 146 overweight patients had reduced blood pressure, compared to only 21% of drug users. And although there is a large drop in blood pressure due to its body weight, the results of this study have shown that these foods increase blood pressure even more favorably. Increase the HDL level. High-density lipoprotein or HDL is called a good form of cholesterol. All this means it's a protein type that eliminates bad cholesterol from your body. As a result, what your HDL is higher, the lower the risk of heart disease. And the best way to increase HDL is to eat healthy fats. Reduce appetite. You feel fewer convulsions. You can survive a low-calorie diet and do not starve when eating a high-carbohydrate meal. Cons. Although the benefits of ketogenic diets is a little bit higher than the disadvantages, some health professionals point out that they have certain disadvantages, including folding fatigue and foggy brain. If you have a ketogenic diet, you probably suffer from fatigue and mental confusion during the first few weeks of metabolic progression. But your body has more energy than it is used to make ketones as the main energy source. Fluctuations in blood glucose are unnecessary. Bad breath. If you do not like it, edit it. Maybe it's not a big deal. But you, and the people around you, may notice that your breath smells like ripe apples because it is suitable for ketosis. This is due to the type of acetone that is excreted by breathing in urine. The odor tries to disperse from time to time and water can help. Changing the lipid substance in the blood. This is a serious problem in people with diets due to fluctuations in fat due to a ketogenic diet. But food can focus on eating healthy fat instead of eggs, butter or bacon. Statistics show that changes in the lipid profile in the blood in some people reduce cholesterol while others are at the peak. Relaxation of microwave deficiencies. Inhibition of carbohydrates in ketogenic foods may have shortcomings and trace elements. To avoid this, you should focus on high-quality multivitamins/mineral supplements twice a day. In addition, use fiber refinement to make sure the digestive process is healthy. Leg pains. At the beginning of their meals, the weight of most of the body weight is lost. In this case, you will lose electrolytes, and this can lead to choices in the middle of the night when you get painfully out of bed. To prevent this, use enough magnesium, calcium, and potassium. If you have difficulty eating, do not worry. You can combine 3 tablets of calcium, magnesium, and potassium from earth skulls. Triggers ketoacidosis. When blood ketone levels are activated, ketoacidosis may occur because the ketones are acidic. This means that my pH in the blood may fall, which may mean death. But that should not be a big problem unless you are a diabetic. Blood sugar levels are always under control and your body allows you to produce just a few ketones at a time. However, if you have diabetic blood glucose levels, you can reach 300 to 2000 mg/dl at normal levels of 80 to 120. When this occurs, there is little relationship between insulin and glucagon, which can stimulate ketoacidosis. To learn more about keto diet, go to www.freedysloseweight.com.